The intended audience for these modules are nursing assistants and caregivers on the front lines of providing care for patients and nursing home residents. The information contained in this module is relevant for anyone, whether or not they work in a caregiving capacity. The purpose of this video is to introduce some basic strategies communities and individuals can use to prevent harms from substance use and substance use disorder. This video consists of audio and visual information. There are additional resources at the end of the video to further explore the topic. Prevention strategies work to educate and support individuals and communities to prevent the use and misuse of alcohol and other drugs, and to prevent the development of substance use disorders and deaths. We know the risk is lower when people use less often and in lower amounts. We also know for young people their risk is lower if they wait until they're older to start using alcohol or other drugs. Their brains are still developing until around the age of 25, and alcohol and drugs impact a mature brain differently than one that is still developing. Strategies to prevent deaths are a combination of strategies to decrease and delay use, and also strategies that make it safer for people to use alcohol and other drugs when they choose to. These might be things like needle exchanges or offering free transportation options on holidays where there may be heavy drinking, such as New Year's Eve. Universal prevention interventions target the general population and are not directed at any one specific risk group. Selective interventions target those at higher than average risk for substance use disorders. Individuals are identified by the nature and the magnitude of the risk factors to which they've been exposed. Indicated interventions target those already using or engaged in other high-risk behaviors. Just like there are certain things that put individuals at a higher risk for substance use disorder, there are also things that can help protect people from substance use disorder. Prevention aims to strengthen protective factors at every stage of development. Some protective factors across the lifespan are supportive relationships with adults and clear expectations for behavior for youth and young adults. Engagement and connections with people in the home and community. For the older adult population, this may be connections with family or peers, clergy, or even staff. Adequate socioeconomic resources such as food, shelter, access to medical care, and opportunities to learn and grow as a person. Another important prevention strategy is the safe storage and disposal of alcohol and other drugs. Too often, the homes of family and friends is the first place a young person might have access to alcohol and other drugs. Storing them safely in a locked box or cabinet can eliminate this source of easy access. When prescription drugs find their way into the wrong hands, it can be dangerous and even tragic. Many people who are prescribed prescription pain medication for acute injury do not use the entire amount. Unused or expired medication should never be flushed or poured down the drain. Removing potentially dangerous pharmaceutical substances from our medicine cabinets helps to prevent them from going into our water supply or getting in the wrong hands. Annual drug take-back events are a great time to go through your medication at home and dispose of any you no longer need. Many police departments and pharmacies also have year-round safe disposal sites for unused or unwanted medication. Overdose rescue medication is an important strategy to prevent opioid overdose deaths. Naloxone, also known as Narcan, is a drug that can help stop an opioid overdose. It can be obtained from a pharmacy or prescriber. Anyone can and should carry naloxone, even if you do not currently know someone at risk for overdose, just in case you happen to be the first responder to an overdose. Carrying naloxone is a life-saving measure. It does not take the place of seeking medical care or treatment for substance use disorder. You can get naloxone with the intention of using it for someone else, just as you would take a CPR class to provide a life-saving measure. Naloxone can save someone's life during an opioid overdose, and it poses very low risk to administer, even if the person is not experiencing an overdose. You can get naloxone for yourself, just as you would carry an EpiPen for allergies. You can carry a naloxone kit that could save your life in an emergency. Naloxone is not usually self-administered. If you carry naloxone, inform the people around you so someone close to you can use it in the case of an emergency. In every state except Nebraska, pharmacists are allowed to dispense or distribute naloxone without a patient-specific prescription from another medical professional. There is a cost associated, so you might look for programs in your community that offer low-cost or free naloxone. Naloxone is safe. In over 40 years of using naloxone, there have been no adverse effects reported from its use. It's safe even if the person does not have opioids in their bloodstream. Naloxone does not produce a high, so it's not in any danger of being abused. Naloxone is easy to use. There are programs offered that provide training, but they're not required. Naloxone comes in a nasal spray or an auto-injection, so it's quite easy to give. If someone is experiencing an opioid overdose, naloxone can cause them to experience symptoms of withdrawal, which can be uncomfortable, so it's important to still call 911 and stay with them until help arrives. Here are a few resources to further explore community prevention strategies, including safe alcohol and medication storage and disposal, and overdose reversal medications. In the previous videos, we explored the definition of substance use disorder, ways to combat stigma, and finding treatment and help for substance use disorder.